Yeah. Okay, let's start compounding review. She's like, using the speaker. What is the standards regarding sterile products? What is the first enforceable national published standards regarding sterile products? USB 797. If it's non-sterile. What's non-sterile then? 795, correct. What is the purpose of the chemotherapy compounding mat? I told you about that, right? Here we use a paper or a doggy pee pad, okay, and all your material should be there. So what do we use that for? No. Yeah, to soak up those chemotherapy or hazardous materials in that area. Okay. So remember, we would use a chemo mat for hazardous chemotherapy. Whatever cures cancer, causes cancer. So all those drips have to be soaked up. Okay. And then we wrap all our materials in there and put it in the biohazard bag or hazardous bag. Okay. What precautions should be taken when receiving and storing hazardous agents? Say yes or no. Inspect damaged packages of hazardous agents outdoors. Do you do that outdoors? No. Store hazardous agents only on the top shelf to avoid being confused with other inventory. No, they're hazardous, so there's a tendency that it's going to fall on you. And again, whatever cures cancer causes cancer. Wear gloves when checking a shipment of hazardous agents. Yes. Which of the following is a primary engineering control? I know Ms. J mentioned this to you. Primary engineering control. Is it the horizontal laminar airflow workbench, the ventilation system, the filtered HVAC system, or the transfer device? Correct. So if you're doing your sterile compounding modules, you know the answer to this as well. Okay. The primary engineering control is your flow hood, laminar flow hood. Okay. Which item should not be in the anteroom of the sterile compounding area? What's the anteroom first? The area before the clean room. That's called the anteroom. Okay. So say yes if it's in the anteroom. Say no if it's not in the anteroom. Okay. Refrigerator. No. Stainless steel table. Transport cart. Direct compounding area. Okay, let me tell you. The only thing that's not in the anteroom in there is the direct compounding area. Your refrigerator is outside. It's outside the compounding area. It's not in the clean room. It's outside. Okay? So it's in the anteroom. The refrigerator is in the anteroom. Okay? The stainless steel table where you prepare stuff is in the anteroom. Okay? The transport cart is in the anteroom. The only thing that's in the clean room is your compounding area. Okay? Which would be required auxiliary label for C2 to C5? What warning is that? The actual words. Take until completely gone, C2 to C5, yes or no? Where do you put that? Antibiotics, correct. For topical use only. Refrigerate. Okay. Federal law prohibits the transfer of this drug to any person that other than the patient for whom it was prescribed. Yes, by law, this has to be put as an auxiliary label on all C2s to C5s. Okay? Federal law prohibits the transfer of this drug to any person other than the patient for whom it was prescribed. Okay. What document or guidelines should you use to make sure you're following the most current standards compounding sterile preparations? USB what? There's thousands of chapters. 797. When you hear the word sterile, it's 797. When you hear non-sterile, 795. When working in a biological safety cabinet, what is the term used when the hands go over objects, causing an airflow block? Shadow. Good job. Shadowing is the correct answer. Remember when you crisscross? That's still shadowing. When you position your sterile compounded preparations under your hands, then it's a vertical flow hood. That's shadowing. Okay. The distortion of airflow when you position it like straight vertically in a horizontal flow hood, that's still shadowing. So there's distortion of airflow. Okay. How often do the sterile compounding techniques of the IV pharmacy technician need to be re-evaluated? Annually, semi-annually, quarterly, or monthly? Oh, I heard her 6 months is what you said. Yes, correct. Semi-annually is 6 months, but the option was semi-annually. Okay, so you need to be reevaluated. Okay, every 6 months, and sometimes it includes the fingertip test. Let me explain to you what the fingertip test. This one, your techniques, they want to check every 6 months. Okay, they want to check, especially in the hospital. Part of this is the fingertip technique. Sometimes, or most hospitals do this. If you're externing in a hospital, the first thing they're going to have you do is to do a fingertip test, which means you're going to wash your hands the correct way, and your fingertips, you're going to touch a petri dish with a gel, right? And then they will culture that, put that in the incubator to incubate bacteria that are still in your fingertips. Okay. Well, there's an amount of bacteria that's allowable and not allowable. And so before you could start in the IV room, they do this fingertip test to see if you properly wash your hands. Okay. It's one of the things before they let you work in the IV room. This is after washing. There will still be some bacteria left. Okay? But there's a specific amount wherein, okay, this is allowable. Okay. It's called a fingertip test. We put it in an incubator and incubate it. It depends how many days, depending on the incubator. Okay. Sometimes it's 7 days. So sometimes they don't let you start right away until the results come out. Okay. Yes, Jessica. How often do the sterile compounding techniques of the IV pharmacy technician need to be reevaluated? Okay. It depends on the hospital. They may evaluate you every 3 months. Okay. But on average, it's every 6 months. Semi-annually is the term. When an object, such as a medical instrument, is sterilized, the microbial life forms on it are made non-pathogenic, destroyed, made as germ-free as possible, weakened in virulence. When you do sterilization, when a medical instrument is sterilized, the bacteria, the microbial life form is what? What happens to it? So the other term for killed, because there's no killed option in here, destroyed. That's what sterilization does. It destroys the microbial life. Which of the following would need pharmaceutical weights to calibrate? I talked about this. I know I did this lecture. So that equipment is measuring correctly. Which one? Okay. Do you use weights for graduated cylinder? No. Do you use weights for a digital or electronic scale? Do you use weights for a pipette? Do you use weights for a class 3 prescription balance? Creams, gels, ointments are given buccally, topically, sublingually, or ODT? Topically. What's the auxiliary label? For external use only. What does ODT stand for? ODT. What does ODT stand for? Orally disintegrating tablets. ODT. Okay. Compromising a quality control measure may result in what devastating effect? Poor documentation, microbial contamination, incorrect expiration dates, termination of a job. Compromising quality control compromises. What's the effect when you compromise quality control? What happens? For documentation, incorrect expiration dates, microbial contamination, or termination. If you don't do a quality control check, there may be microbial contamination. What's a quality control check? You putting it up the light is a simple quality control check. Was there coring? Was there a piece of rubber in it? Was there a black particle in it? Okay, that's a simple quality control check. Okay. A sealed glass or plastic container with a rubber seal and hard plastic cap is known as the vial. It can be plastic, it can be glass. It has a sealed rubber with an aluminum around it. That's a vial. Okay. What about the glass that you break? What do you call that? Capsule.
What?
A glass that you break with drugs in it. If a medication is injected into the skin, that is often referred to as what route or route of administration?
I don't know how to say. That would be like IV injections or something. Yeah.
What's the term?
Parenterally.
Correct. Para means outside, enteral means intestines, outside the intestines, parenterally. Parenterally. Correct. In what situation do you need to use a master formulation record per guidelines in the USP chapter 797? Okay. When the label provides your constitution instructions, do you think you need a master formulation record when the label has all the instructions? No, you always have to remember that the most accurate reference for a drug is its label or its product insert. Okay, because it came from the manufacturers. Okay, so you don't need other references because the most accurate one is the label, okay, or the product insert for that particular drug. Every time a product is made in the buffer room, do you need a master formulation record for that? During all non-sterile compounding procedures, or when the manufacturer's label does not provide instructions for the ordered medication. That one, remember I told you when you were compounding or reconstituting antibiotics? What did I say? If the label has the instructions, follow the instructions on the label. If not, that's when you get another reference. Okay. What is the term used to describe the tweezers-like instrument that technicians would use for picking up weights used in balances? I put it on the board. What do you call that term? I said they would call it tweezers. They are called forceps, correct. And why do we use forceps when we're handling weights? I explained this. Why do we use forceps? This questions show up on the PTCE.
Because our fingers are
Our fingers have body oils that corrode, okay, or causes the rust on our weights. Our weights are made of brass. What is another name for repackaging bulk meds, such as tablets or capsules, into cards or individual doses? Blister packing, but it's also called, what's that term? Bubble dosing, punch card dosing, beyond use date, or unit dosing? Unit dosing. Beyond use date is a date that we use that's not the manufacturer expiration date. The moment you take out the drugs, the tablets, the capsule from its original manufacturer bottle and you repackaged it or reconstituted it, that term now becomes BUD, beyond use date, no more expiration date. Is that clear? Expiration date is a term that the manufacturers use. BUD. BUD, beyond use date. BUD. Okay? Beyond use date. We use the 6 months from the time we touched it or we compounded it. Remember, I gave you the instruction. Okay, your packaging, your blister packaging, use 6 months. Okay? When the expiration date is in the format of month/year, what does that mean? The expiration is when? When the expiration date is month/year, what's the expiration date? The last day of that particular month. What was your question? What do you call when you repackage bulk meds, such as tablets and capsules, into individual doses? What does pathogen mean? Anybody?
Disease.
Disease, you're on the right track, Kathy. Continue. What's pathogen? Disease-causing organism. Correct. Disease-causing organism. Just think about bacteria. Yeah, disease-causing organism. What's patho? Study of the pathology. Study of diseases. Okay. What is the life-threatening reaction that happens when a patient has a healthcare-associated infection that is so threatening that the body's immune system goes into overdrive? Good job. Sepsis is the correct answer. Sepsis. Okay. There's another term I'd like to talk about. Nosocomial infection. It shows up on the PTCE. That's why I want to talk about it. Okay? It's called nosocomial infection. When my son heard me say this, he's like, "Oh, that makes sense, Mom." Because nosocomial, I think he said, means hospital. Okay. What's nosocomial infection? Nosocomial infection is a hospital-acquired infection. Okay. Commonly, MRSA. Methicillin-resistant Staphylococcus aureus infection. Okay. This is the reason why when you get hospitalized, the hospital has a goal of discharging you within 72 hours. Why? The longer you stay in the hospital, the more likely you're going to acquire infections from other patients. Okay? This is one of those places. Like yesterday, I was at St. Rose Hospital. The first thing I did when I got home was to change my clothes and shower. This is one of the places where you can get a lot of virus. See, it's like patients are waiting. Okay, so going back, nosocomial infection or hospital-acquired infection. It can be pneumonia, but the most common one is MRSA. Okay, that's why the hospital have goals of discharging our patients within 72 hours. The longer you stay in there, okay, the most likely you're going to get infection. When I say pneumonia, that's a community-acquired pneumonia or hospital-acquired pneumonia.
If you're to get one, would it be the hospitals?
No.
Just get it.
You just get it. And you know what the problem is? Like for MRSA, there's no one antibiotic that kills this bacteria because there's no treatment for it except for multiple antibiotic regimen. They're so strong. They're methicillin resistant. They're resistant bacteria. Bacteria is plural. I'm sorry. Bacterium is singular. virus, okay, and fungus, technically, or singular. So it's plural for fungus. Fungi. What do you think is the real plural term for virus? It's technically viri, but we use viruses. Fun fact for today. Yeah. Curriculum, plural. Curricula. Dice. I was talking to this about my son. Die, Old English. Okay, but Grammarly said, because we had to look it up. Dice now is both acceptable singular and plural. Dice. The dice you throw?
Oh,
throw the
dice.
dice. Throw the dice. Yeah, throw the dice. And my son says, Mom, it's applicable singular and plural. So I checked. And then there was an explanation in Grammarly. Grammarly said modern English accept dice as singular and plural. But die is singular. Old English. Okay. Dice is plural. That's why I roll the dice. It's two. Okay. Interesting, right? Bacteria is plural. Okay. Bacterium is singular. Curriculum is singular. Curricula is plural. Yeah. Fungus is singular. Fungi is plural. Okay. So interesting facts. Okay. Nosocomial infection, hospital acquired infection. Okay. It's hard to treat, huh? There's no one antibiotic. Something went in my eye that treats it. Okay. In what PEC? Oh.
Eye drops.
I know it just happened.
Don't eye watching.
But I'm wearing contacts. So
It hurts.
let me.
Yeah, if you have it, then that's my It's okay. Weezers use working of voices. No, I love it, and I think it's, yeah. Yeah.
Okay, I'm back. I don't know what that was. I had to wash my contacts. In what PEC would non-hazardous aseptic compounding be performed? A. Anterior room. B. Vertical flow hood. C. Biological safety cabinet. Or D. Laminar airflow hood. Good job. What does PEC mean? Yes, that was my first question. Earlier question. Primary engineering control. So that's your laminar airflow hood. Let's see. What is the reason for using glass syringes instead of plastic syringes in a sterile compounding? Why do you think? Think about plastic. What happens to plastic? It can melt. Okay, right? So certain chemotherapy drugs, we use glass syringes. Okay? Another thing. Okay, we have what we call, this is a common question in a pharmacy board exam. Leaching. Which a life hack that we'll tell you about. Leaching. Leeches. Okay, leaching. So you know how they say don't leave water bottles in the car if they're in a plastic container? It is true because of leaching. Okay, what is leaching? This is when chemicals of that plastic, which is bad, get melted because of extreme heat, or the heat in your car melt and go with your water, and you're drinking that toxic substance or material. That term is called leaching. Fair.
What was the answer to that question?
Which one? Why do you use glass syringes? Yeah, glass syringes are used when certain chemotherapy products are prepared. Hazardous, not all. What does D5NS mean? Dextrose with, what's D5NS? Dextrose, 5% normal saline. What guidelines would technician follow for non-sterile compounding? USP 795. Non-sterile is 795. Sterile is 797. What about hazardous? Handling hazardous materials. Correct. USP 800. Handling hazardous materials. Those three always show up. Okay. Which agency has the authority to enforce GMPs, or good manufacturing practices? Is it the TJC? Is it the Food and Drug Administration? Is it the USP, or is it the NABP? Good manufacturing practices. FDA. FDA has the authority, okay, to enforce good manufacturing practices. What is the term used to describe the leaking of IV fluids into the tissue surrounding the injection site? What is the term used to describe the leaking of IV fluids around or into the tissue surrounding the injection site? Bolus. What's a bolus?
That's on me.
Okay. Bolus is fast. It's like an IV push. One fast one. When you say injection, bolus. Particulate, infusion, or extravasation. Extravasation. Extravasation, again, is the term used to describe the leaking of IV fluids into the tissue surrounding the injection site. Say yes if it has to be on the label that the patient would receive on a prescription bottle. Say no if it does not have to be on the label. Okay? Drug name. Yes. Patient name. Manufacturer, especially if we're dispensing the original manufacturer bottle. Patient's disease state. No, it's not required. They don't have to put for erectile dysfunction. They don't have to put for pain. That's why if the doctors didn't put that, you don't put that on your SIG. Is that clear? Because there are drugs that have two functions. Example, Wellbutrin, which is a common question on the board exam. Wellbutrin is an antidepressant, but may also be used as a smoking cessation drug. Okay, so if the patient walked in the doctor's office wanting to stop smoking, and the doctor put Wellbutrin on the prescription, and then you thought that that is for depression, and you put for depression, but the doctor didn't put the words for depression, that's not right. Why? The patient's probably thinking, I'm happy as a butterfly. Why did the doctor give me an antidepressant when I said I want to stop smoking? So you never add anything on a SIG except for the verb, which is apply, insert, instill, okay? And the route or the route. Because most doctors don't put PO or by mouth when necessary. And you want to be clear. Suppositories, some suppositories look like tablets, but they're not meant to be swallowed. They're meant to be inserted in vaginal cavities. Okay. So those are things that you want to remember. Piece of equipment that uses heat and pressure to sterilize instruments and supplies. I say this word a lot, and I tell you this when I told you the story about me making IV bottles. I'll measure water, I'll add salt, I'll seal it and send it for sterilization or autoclaving. Autoclave is the equipment for sterilization. Autoclave. That's an equipment that we use to sterilize. Back in the day, we didn't have a lot of IV bags yet, so I make IV water, and then the water I'll add salt in it. That's my job during swing shift. Okay, I'll measure the salt for making normal saline from scratch back in the day in bottles. We'll seal that bottle for sterilization, and that equipment that we use is called an autoclave. Okay, autoclave. What auxiliary label is required on liquid suspensions? How are the compounding aseptic isolator and horizontal laminar flow workbench alike? Okay, remember I was discussing with you the glove box? Okay, that's called your compounding aseptic isolator. Okay, and then your horizontal flow hood, where's the airflow coming from? Back to front. That's why it's horizontal. Vertical flow hood is top to bottom. Those glove boxes are usually vertical. Okay. They have, remember I told you a divider, everything's in there already. Okay. Both have a shield that stops about 8 inches from the work surface. Is that correct?
Yes.
8 inches from the work. Both allow sterile compounders to place their hands in a pair of fixed gloves. No, only the isolator. Remember I told you the glove box has latex arms and you change the gloves. But here we have a horizontal one. Is there an arm? No. Both vent air through a high efficiency particulate air filtered ventilation system. Both have HEPA filters. Okay, both have HEPA filters. What should workers do, HD workers do, when cleaning up a hazardous agent spill? Hazardous drugs, okay? Start from the center of the spill and work outward. Wipe up liquid spills with damp cloth or towels. Start from the edge of the spill and work inward. Seal contaminants in a double bag before putting in the trash container. The question is cleaning. Cleaning. It's not saying disposing. Out to in. Yes, out to in. And then disposal would be put it in a hazardous bag. Everything that you used. Okay. That's why chemo is different, because it comes with everything that you need in one package. Okay. Even the mat is there. Okay. What does pyrogen mean? Not pathogen, but pyrogen. Pyro is fire, so pyrogen is if pathogen is causing disease, pyrogen is causing fever. Remember, antipyretic. Remember that? What did I tell you about antipyretic? It came from the word pyro, which means fire. Anti is against. An example of this is your Tylenol or your acetaminophen. Okay? Antipyretic, anti-fire. It lowers fever. So pyrogen are fever causing. Pathogen are what? Disease causing. By not following the policy and procedures for compounding sterile products, the pharmacy technician is at risk of causing staff contamination, nursing errors, superbug, or CSP contamination. What does CSP mean? What do you mean? Space of USB 797. So what's USB 797? Okay. So USB 797 is compounding guidelines for or standards for compounding sterile preparation. So CSP is compound or compounded sterile preparations. When do you take off used personal protective equipment? At the end of the day, before leaving the hazardous drug preparation area, when you return to the pharmacy, when you're done compounding in the DCA. Which one? When do you take off PPE? Every time you leave the clean room, okay? What's part of the PPE that you can reuse? The gown. What do you do with it? You hang it. How long can you use a gown? One whole day, your entire shift. So when you go on break, you can hang it, okay? When do we double glove? When working with hazardous. When do we double gown? When working with hazardous. Good job. What reference will a pharmacist use to determine the chemical drug compatibility or incompatibility of 3 medications added to an IV solution? Okay, listen. Is it USB 797? Is it USP? Is it material safety data sheet? Or is it tristle stability of compounded formulations?
Can you repeat?
What reference will a pharmacist use to know if there's incompatibility between 3 drugs that are going to be injected into the IV bag? It's actually trissels. The original title of this book is Trissels Injectable. Okay. Trissels Stability. So complete title of this book. It has something to do with injectable. Trissels. Let me pull up the complete title of this reference book. Tristle stability of compounded formulations. Back in the day, it's called Trissels injectable drugs. Okay. So you can see incompatibilities of ingredients that you inject in your IV bag by referring to trissels. Okay. Trissels is spelled as, that's the book for injectable drugs. But the latest edition is called Trissels Stability of Compounded Formulations. Back in the day, it's called Trissels Injectable Drugs. It's a reference for incompatibilities of injectable drugs. What is the term used to describe when a pharmacist or technician uses bulk ingredients to prepare a specialty prescribed medication that is not commercially available? When you're preparing, what are you doing? It's not available, so you're making it. What's that term? Compounding. Because if you're making it in bulk, it is manufacturing, right? If it's not available commercially, okay, it can be as simple as Benadryl, right? Benadryl. Remember my story? I ran out of Benadryl, but I have Benadryl tablets. I crushed the Benadryl and put it in water or apple juice, and I have my Benadryl solution. That's compounding. What you're doing right now in your project is compounding. It's not commercially available, right? Okay. Which of the following would contain gloves, gloves, shoe covers, waste disposal bags, goggles, incident reports, and disposal scoops, among other supply? What do you call that kit? No. I told you this. When you're preparing chemotherapy, you don't have to pull all of this supplies individually because it comes in a kit. And that is what you call a spill kit. Remember, it has goggles, It has the mat, the chemo mat, the hazardous bag to dispose of everything. It's all in there in the kit. We call it a spill kit. Okay. Spill kit. Spill kit at the back. If a medication is to be administered PR, what does that mean? Per rectum or rectally. So, what is the dosage form? Correct, suppository. Investigational drugs. What describes investigational drugs? What do you think they are? Do you think they're approved by the FDA? Not yet. Okay. Investigational drugs, it's in your lecture packet. Investigational drugs are drugs not yet approved by the FDA. However, they're being used usually in hospital or institutions, okay, because they're still under testing. What do I mean by that? Say, for example, there's a patient with a specific type of disease. There's no cure for it, okay? But a study is being done, especially in major hospitals, okay, where they have investigational drugs, okay? Now they offer this to patients with that particular disease that doesn't have a cure. And they have to show this studies. These are the studies. We've had good results, but know that this is an investigational drug, meaning it's not yet FDA approved. But we've found from our patients who went through this investigational drug, like there's like 20 or 30 patients who had good results on it. And hospitals or institutions, usually cancer institutes, offer this to patients. Our regular hospitals have investigational drugs. Okay, so they're not approved by the FDA yet, but they can be used to specific groups of patients with specific diseases. And this usually are drugs. These are diseases that don't have cure yet. Okay, hospitals have access to this, especially teaching hospitals. Okay. Investigational drugs, medications not yet approved by the FDA, but are in testing phase. What's USB 800? Hazardous. How often must pre-filters in all PECs be replaced?
What?
How often must pre-filters in all PECs be replaced? First. The answer here is 30 days. So it's the pre-filters. But as far as I know, the hoods, laminar airflow hood, this shows up on the PTCE. Must be certified every 6 months. Okay. And that's when we change the filters as well. Okay. They change the filter before they certify. Okay. But here the question was, how often must pre-filters be replaced? And the answer is every 30 days. So if you're asked, how often must the hood be certified? The answer is every 6 months. Okay. Another thing that showed up on the PTCE is, how often do you have to clean the hood? Once every shift. Correct. How often do you clean the shelves, the walls? Once a month. Correct is the correct answer. Okay. Once a month is the correct answer. How long do you have to run the hood before you could use it? 30 minutes. How long do you have to wash your hands? 30 seconds. Those numbers, okay? How far in the hood should you be working? 6 inches. Or if it's 2 numbers, it has to be 6 and 3, which is which? 3 inches from the back, 6 inches from the front. Remember, you have to be closer to the filter. Okay, those numbers always show up. Okay, How often to clean the hood? Once every shift. But I actually clean the hood before I prep most of the time. Okay. But as a general rule, once every shift. The walls, the shelves, once a month. Okay. Run the hood 30 minutes before using. Any questions? Any questions? 52 questions for the final exam for compounding, 51 for customer service. Any questions? The time left, you can start working on your project and feel free to ask me for any information. Okay, you can say at the back, at the lab, if you need the mortars, pestles, and everything else that you need at the back. The only thing we don't have right now is heating. So I couldn't find our hot plate. I know we threw away my griddle because it got flooded. So check. Oh no, I told you what sizes did I order? 0 and 00. So I'm gonna go to my car and get those bags, boxes. Okay, and somebody go with me because I have 2 boxes. Okay. I have a size 0 and a 00. Okay. I'll see you. I'll go down and I'll see you again. Okay, who's coming with me? You gotta exercise, Steve.